off insulin, off medication, cease to be diabetic, cease to have polycystic ovary, don't have fatty liver anymore. All of that every day. See, there is something called genetics and there is something called epigenetics. Epigenetics is above your gene. That's your lifestyle. Zero processed food for that matter. So everything that comes out of a tin, can, bottle, has a long shelf life, needs to go. Because we're the diabetic capital of the world. And what is diabetes? It's nothing but a sugar disease, which is going to convert to heart disease.
Hello and welcome to Buzz by the Bay. Now, if you think that diseases like type 2 diabetes, obesity and fatty liver are irreversible, then think again. Our guest today will probably prove you wrong. She is a medical doctor with a difference, as she will help you reverse these ailments without making you swallow too many bitter pills, using a combination of nutrition and medicines. Very pleased to have with us in the studio physician, award-winning nutritionist and best-selling author, Dr. Vishakha Shivdasani, also known as Dr. V on Instagram.
Hi Anushka, thank you for having me here. Thank
Great
you for
to have
that
you in the studio.
lovely introduction. Thank you.
Glad you liked it, and it's all very true and accurate, and the listeners will the viewers will find out. Starting off with, your practice. You are more holistic in your practice, right? You practice functional medicine.
That's correct.
So for the sake of the viewers, can you tell us, break it down, what exactly is functional medicine?
Okay, so let me compare it with conventional medicine, what I am trained to do. In conventional medicine, we are taught how to treat the symptoms and the effect of a disease. In functional medicine, we get to the root cause of the disease. Also, functional medicine is not so much for infectious diseases, but for chronic metabolic diseases. Most of them have a common denominator of chronic inflammation.
Right.
So therefore, instead of treating the symptoms that happen because of diabetes or PCOS or fatty liver, we get to the root cause and we try to not only prevent the progression, but also reverse the condition.
Right, absolutely. So you tackle it at the root, right?
At
not
the root.
Just symptomatically.
Absolutely correct.
And which actually helps you reverse the ailments, because so many people think that diabetes and fatty liver and ailments like this are not reversible. So let's say I was a patient and came to your clinic with diabetes, obesity. What would a typical consult look like?
Okay. So first I need your medical reports because no two people with the same ailments have the same medical parameters. So I would need a recent set of blood reports done, say in the last 3 or 4 months. And I would also need to know your family history because most people who have diabetes, whose parents have diabetes, come into the clinic saying, is that my destiny? Am I going to, be diabetic, or am I going to have heart disease just because my parents have it? So there are certain testings we do, genetic and otherwise, which tell us if you're going to be predisposed to the condition. And that's the time really I can prevent it. So I can prevent you from getting the disease. And if you've come to me at a time where you already have it, then the blood report will tell me how far gone you are, how metabolically broken you are, and how long it will take me to fix you and get you back.
Mm-hmm.
So then based on that, I, have a team of people who will draw out a chart for you, tell you what you need to eat, your lifestyle. Functional medicine is not just about nutrition. So it's about what you eat. It's how to take care of your stress. Sleep plays a huge role, your exercise, and also certain supplements, which hugely help. More often than not, in a few months, I just start knocking off medications.
That's amazing. That's really amazing, because diabetics, I know from diabetics in my family how much medication one has to be on. So let's say, have people actually come to you being on insulin injections, and have you actually reached a point where they don't need those insulin anymore?
Every single day. Off insulin, off medication, cease to be diabetic, cease to have polycystic ovary, don't have fatty liver anymore. All of that every day.
Amazing. And nutrition, that's something you added on to your degree later on, right? So when did you decide to bring nutrition in? When did you realize it was such an important factor?
I think I've always been healthy and interested in health. And right through med school, I would also read books on health, which were not just prescribed to us in medical school, though time was very sparse. But when I started practice as a physician, I think maybe a few years into it, I realized a lot of the medicines that I was giving my patients, those medicines were causing side effects. And then I was giving them more medications to take care of those side effects. And it was just a vicious cycle. So I said, there is more that I can actually do for people. So I took a sabbatical, did a fellowship in nutrition, came back, formalized it because degrees are very important in this country. Now, of course, we've got a few thousands of people as my patient base.
You spoke about preventing, help people, preventing diabetes when someone comes to you and they're predisposed to it. So how would you do that? Is that also mainly through nutrition?
Through lifestyle. See, there is something called genetics and there is something called epigenetics. Epigenetics is above your gene. That's your lifestyle. So the genes load the bullet, load the gun, but your epigenetics, your lifestyle actually pulls the trigger. If you follow a certain protocol, certain lifestyle changes you make, you're not going to get to that state where you are going to have, forget diabetes, even insulin resistance, because we can reverse that, and that's pre-diabetes. If you do XYZ things, chances are you're never going to become a diabetic.
So XYZ as in what? Can you just... What are the main things? I'm not trying to make out all the information from you, but the main...
No, I would love to give out all the information. It would just take me a few years. Okay. I would say, of course, have zero processed sugar. Mm-hmm. Zero processed food for that matter. So everything that comes out of a tin, can, bottle has a long shelf life needs to go. Everything that is fructose, which is liquid sugar. So a lot of people think fruit juices, oh, but it's freshly squeezed, it's great for me. No, it's not good for you. It's just going to convert into a fatty liver, going to convert into insulin resistance, and then to diabetes, heart disease, and what have you. So stop your simple sugar, stop the processed food. Eat your carbs, don't fear them, just eat your good carbs. Mm-hmm. Eat your protein, but I'm not a big fan of very high protein. So eat adequate protein for it to perform the function it needs to. And for Christ's sake, don't fear your fats. So just eat the good ones. It's so vilified. So eat those. And then, of course, based on your medical parameters, there are certain supplements to support what is out of range. Right. So for a pre-diabetic, it could be chromium, it could be zinc, it could be magnesium, if you're not sleeping well, melatonin, so many things. But that is, of course, bio-individual. So
you spoke about fatty liver. So again, for the viewers, what really is fatty liver? What are the risks that it poses to you? How do you diagnose it?
Okay. So if you look at your blood parameters, you can tell if a patient, because of the liver profile, then you ask for a sonography. You can ask for an elastography, which is a little more sophisticated sonography. Based on that, you can tell if the patient has fatty liver or not and the grade of fatty liver. And it's a chronic progressive disease if not treated. The irony of it is, if treated just with supplements, unless you're far gone and you have cirrhosis, if you treat it, if it's stage 1, stage 2, just doing those, that protocol, you can not only arrest it, you can reverse it.
Right. And it's great to meet a doctor who will, combine the two, like nutrition, and not, give you a plethora of pills, because the minute you have high cholesterol, a doctor will give you statins, and statins have a lot of side effects.
You touched a sore nerve with me.
Okay.
I'm not a fan of statins at all. I think statins come with huge amount of side effects. You don't need to worry about your cholesterol profile. Worry about your triglyceride. Worry where your good cholesterol is. The small particle LDL, which we never see done in most of the reports. So if you're doing those things,
small particle LDL.
Yeah, I mean, the lipoprotein, small a. There are other specialized tests that we do. But honestly, if you focus on that, heart disease should be a thing of the past.
Because it's so prevalent in India, right?
Of course.
We have the highest incidence of heart disease.
Because we're the diabetic capital of the world. And what is diabetes? It's nothing but a sugar disease, which is going to convert to heart disease. So one leads to the other.
So how do you actually get over sugar addiction?
You are asking me for all my tips and tricks here. Okay. You begin your day correctly. See, why is one addicted to sugar? When you begin your day with a carb-filled breakfast, certain cereals for weight loss, again, I'm not naming any, but when you do that, or when you eat oatmeal, which is supposed to be great for your health, great for your heart, when you're eating a carb-filled meal, what is the function of carb in your body? You know how we say carb gives us energy? Why does it give us energy? Because it's glucose. The glucose goes up and you get that surge. But as soon as that goes up, it also causes a crash. The same way caffeine causes a crash, and then it goes down, and then you want more sugar. Now remember, everything savory that's carb is also sugar in the body. So have you ever stopped at one chip? No, you'll watch Netflix and go through the entire bag. At least I know I would if that were my diet, or at least it was 15 years ago. So anything that you eat, savory or sweet, is going to convert to sugar, is going to give you that crash. And when that happens, you're going to crave more sugar. Sugar lights up the same receptors in the brain that cocaine does.
Oh, really?
Yeah. And yet, we don't give our kids cocaine. Is there anything that sugar offers you besides instant gratification? And there is something to be said about that. No, and all of us, me included, we need that instant gratification once in a while. But when you're hooked on, then it is an addiction, and that is a problem.
PCOS. Now that's another, ailment that a lot of women have, but most women are not so aware of it in India. So how do you encourage them to get a consult? And how do you actually detect this? And again, what are the risks that it poses?
Most women, especially in our country, think of PCOS as a taboo. Whether it is their family, their in-laws, they think that if they've got PCOS, infertility is their predicament. That they are not going to be able to conceive. They're not going to be not going to be able to have a child naturally. And they're going to go in for XYZ procedures. And it's such a taboo. And that is so sad, because this cannot be further from the truth. Again, you do this lifestyle intervention. You just follow the basic protocols for a few months. It's a hormonal condition, which you don't have any of those symptoms anymore. The hormones just regularize and you can have normal conception, normal delivery.
Coming to everyone's favorite topic, weight loss, obesity reversal. All right, that is one of your specialties. Disease reversal in general, I know, but weight loss. So what makes you so popular?
The fact that I don't deprive them. I always say it's not a deprivation diet. It's not that nothing should be completely out of bounds. Everything should be in moderation, and you should know how to work around things. People are so obsessed with calorie counting and going into calorie deficit. That might give you a temporary small loss, but you're losing muscle, not fat, which is the most unhealthy kind of weight loss. So I teach them to make a complete mind shift from focusing not on calories, but on your macros. Mm-hmm. Also, obesity is a result of bad hormonal profile. When we eat, sugar goes up, insulin goes up. When insulin goes up, insulin signals to the rest of the body to store fat, because insulin is a fat storing hormone. Mm-hmm. So every time you're eating, you're storing the insulin. So you tell me, then what should the solution of obesity be?
In such a way that you don't have spikes.
That's correct.
In your sugar.
That's correct, which means you either eat less frequently, basically whatever is going to not cause your insulin to spike. Now, what are the two main ways we can do that? One is on a keto diet, when you don't have you don't have as much of a spike, or you fast. Now, personally, I'm not a fan of a keto diet only because I don't like things that are not sustainable. And in my books, that's not sustainable. But to fast is easy. So if I were going out today and I'm going to have an indulgent meal out or an indulgent night out or alcohol or whatever it may be, I know I can offset it by not eating for a certain number of hours.
Right.
And my insulin, even after spiking, is going to come down to base level, is going to stay there. So I'm not going to keep telling my body now it's time to store fat, because my body needs the energy after X number of hours. Mm-hmm. So now it's going to go into burning mode and it's going to start burning that same fat.
But intermittent fasting is becoming hugely popular. I mean, what do you think of that trend? I mean, yes, explain the science behind it. And do you recommend it to many of your patients? And is it really something that anyone can follow, or you have to have a certain profile to follow it?
I don't like the word trend, but the fact is it is becoming a trend. And it's becoming a trend because everyone is doing it indiscriminately. That can cause more harm than good. So, especially with people who've got thyroid issues, who've got PCOS, who've got diabetes, if they do it without guidance, they can actually get hormonal fluctuations. A diabetic can get what's called a dawn effect, where the morning sugars actually spike, and then I get SOS calls saying, oh my God, I'm doing this thing, but my morning sugar is suddenly like at 200. What have I done wrong? I haven't eaten anything. So, or I get people who get osteopenia long term. So I have patients who I have seen who come to me after having done it with someone else or on their own for 2 years and 3 years, and now I've gotten really weak bone. This is your body, this is medicine at the end of the day. So don't follow what an influencer is telling you, or just make sure you're going to someone who knows what they are saying and do it in a proper protocol.
Another trend, ozempic. A lot of the stars are taking this anti-diabetic drug and it suppresses your appetite, I believe, and they're shrinking in size. What's your view on ozempic?
Don't take it.
Okay.
Look, I don't believe in any magic bullet. Okay, and people are looking for that magic bullet, whether it is a supplement, whether it is a superfood, whether it is a super drug. But the fact is, you can't out supplement a bad diet, you can't out exercise a bad diet, you definitely can't out medicate a bad diet. So all of them come with side effects. What are you losing? There are studies that have been shown with Ozempic, what you're losing is not fat but muscle. So that's why you get what's called the Ozempic face.
Oh, what is that?
When you actually look so gaunt and you have lost every ounce of fat on you, and we know there are lots of celebrities, where we can see who've got the Ozempic face.
Oh.
And, that's only one of the side effects. Why would you want to do it when you can do something completely naturally? Because it takes more effort, but it has to be a lifestyle. With Ozempic, it works while you are on Ozempic, and the minute you're off it, all the weight comes back on.
So backfires.
Yeah.
And what about the hazards? Are there other hazards to taking Ozempic?
Yeah, barring the initial nausea, vomiting, queasiness, and all of that. And of course, you have certain, small risk of thyroid cancer, pancreas cancer, but it's not like a migraine, no? It's still cancer.
Macros. So protein is important, but you said not too much protein.
Yeah, I'm not a fan of too much protein. I think you need enough protein for it to obviously do its functions. You need protein for immunity, you need protein for synthesis of other enzymes, you need proteins for muscle building, for everything. So there's something called MTOR, which is mechanistic target of rapamycin. Tell me if I'm too technical. When you eat too much protein, you actually get a rise in MTOR. Now, MTOR is great to build your muscle, to get the six-pack. It's fantastic. And if you're in the growth phase, like if you're pregnant, you need that kind because you're growing. Or if you're a young boy in his 20s or a girl who's trying to, get the six-pack in the gym, it's fine to get your mTOR high. But when you're in the second half of your life, where you're not growing anymore, right? You need your mTOR to be low. At that point, if your mTOR is really high, you're actually reducing your lifespan. If you're going to have excess protein, also understand that you're increasing your chances of cancer. Documented.
So many influencers who are not doctors, and they give you so much health advice on Instagram. Diet advice, health advice.
Well, Instagram has made it really easy, right? They've made authentication for $6.99 now. So anyone can be a healthcare provider. Anyone can say anything. But I think the audience also needs to be discerning. I think it's silly just to follow. So look at the credentials of the person. Look at the age of the person.
All right, a little bit about your personal journey before we go on to a rapid fire. Did you always know you wanted to be a doctor ever since you were young?
Yes, young? Always.
Really?
I think I was in love with my pediatrician.
Oh, where did you go to med school?
I went further down Pune to Krishna Institute of Medical Science. And then I came back. I worked in Bombay Hospital. I worked in JJ Hospital. I worked with some stalwarts in medicine.
Would you say you're constantly educating yourself? You did a nutrition fellowship nutrition after you did medicine. I mean, what next? Is there something else?
I don't think learning should ever stop. I think as long as you're living, you should learn. I think the day you decide that you know enough is doomsday.
You look great, in great shape. How do you maintain yourself?
I typically have a really early dinner, skip my breakfast, go to the clinic, have my cup of black coffee there, which all my patients know. And then I go and I have a carb lunch. I eat 1 carb a day, every single day. Sometimes I eat 2 carbs a day. My sugar intake is close to 0. I do eat dark chocolate though. And I'll drink on the weekends, but I don't use mixers. I don't use juices.
Okay, Dr. V, can you give us 3 mantras for success?
I think there is no substitute to hard work. Absolutely. Especially when you're a doctor, because you need that knowledge component. Your eyes can't see what your mind doesn't know. So I would definitely say hard and smart work. That would be one. B, do whatever in life you're really passionate about. And I don't think there's a substitute to that if you want to sustain even the hard work, because it doesn't seem like work then. And you need to be resilient. You need to be very, very resilient. And that was very true for me because I did something that was out of the box. And when you do something out of the box, and when you're a girl and when you're single, you'll have the whole world and his neighbor trying to give you unsolicited advice, especially when you're trying to make a paradigm shift.
Mm-hmm.
For me, that's what I was doing. So my own friends, my own contemporaries, they'll say, now you're giving up medicine, you're becoming a nutritionist.
Okay.
So,
all right. So those are the three: hard work, passion, resilience.
Yeah.
Oh, those are three very good mantras.
Thank you.
We're going to do a quick rapid fire round. If not a doctor, then what?
Stockbroker?
What do you dislike most about your profession?
The fact that my own colleagues don't understand what I do.
Your favorite cheat meal?
Pizza at 3 a.m.
Your biggest inspiration in the medical world?
Dr. Singhal, who is the very famous neurologist and the Dhanvantri Award winner.
All right, Dr. V, we're going to do a section called Myth or Fact. I'm going to read out a statement and you can tell us whether it's a myth or a fact. All carbs are bad for you, or you need to go off all carbs to lose weight.
Myth.
Myth?
Hell yes.
All right, so then what is the truth?
You need to go low carb diet, not on a low carb diet, not on a no carb diet at all.
You need very high protein diet for weight loss.
Oh, I just explained that to you. Hell no. You need to, of course, work with your healthcare provider to see how much you need, but definitely not on a very high protein diet.
Protein supplements are important for you. Whey protein.
If you're convalescent, if you're sick, if you come out of a surgery, yes. You've got cancer, yes, because you need that extra protein. Else, hell no. Myth.
Fats are bad for you. You need to be on a low-fat diet for weight loss.
Absolutely not. You need to be on a good fat diet. That's an anti-inflammatory fat diet. And you need to give up all the pro-inflammatory fats. So that's a myth.
So what are the good fats?
Avocado, coconut, or ghee, but the A2 ghee, all of those are great. Olives, olive oil.
Veganism leads to better health and generally, more specifically, less heart ailments.
Myth. You're asking me a moral question. So if someone came to me on moral grounds saying that they wanted to be vegan, that's not my turf. Yeah, it's your call. But if you're asking me as a doctor, is myth. You're going to see so many deficiencies, which I see every day at the clinic, and then I'm rectifying those deficiencies.
Fatty liver is only caused by excessive drinking.
Myth. Absolutely not. It's only one of the many, many reasons it can be caused because of fructose, sugar, refined food, which is the basis of most things and most health issues. And of course, you can have a lot of NSAID group of drugs, which are basically a lot of painkillers and overuse.
A woman can't lose weight after menopause.
Myth. Maybe your weight loss can slow down and maybe you will have fat on certain areas of your body more than the other. But will you lose weight? And in my mind, when I say weight, I mean fat. Mm-hmm. Absolutely you can. No question.
That was really informative chatting with Dr. V, and I feel healthier and fitter after this conversation. Follow her Instagram for fantastic information and great knowledge about how to reverse diseases. Stay tuned to Buzz by the Bay for more such inspiring conversations.